The story of Michael Jackson's nose is one of the most documented and scrutinized medical journeys in entertainment history. What began as a relatively simple cosmetic procedure evolved into a decades-long odyssey of surgical interventions, each one leaving its mark on the most famous face in pop music. Michael Jackson's relationship with his nose began long before any surgeon's scalpel touched it. Born on August 29, 1958, in Gary, Indiana, Michael had what would be described as a broad, distinctly African-American nose with a wide bridge and rounded tip. In the early years of his career with the Jackson 5, his nose was prominent but not unusually so. It fit his face, which was then round and boyish. Photographs from 1969 show a 12-year-old with soft features and a nose that, while not conventionally perfect, was entirely appropriate for his ethnic background and facial structure. The first documented surgical intervention on Michael Jackson's nose occurred in 1979. The procedure was a rhinoplasty, performed by Dr. Stephen Heflin, a prominent Beverly Hills plastic surgeon who would become one of Jackson's primary physicians over the next 2 decades. Jackson was 21 years old at the time, and the surgery was reportedly motivated by 2 factors: a desire to refine his appearance as he transitioned from child star to adult solo artist, and a genuine breathing difficulty he had experienced since childhood. The 1979 rhinoplasty was relatively conservative by the standards of what would follow. Dr. Heflin reduced the width of the nasal bridge and refined the tip slightly. It was a standard cosmetic rhinoplasty, the kind performed on thousands of patients every year. The results were subtle enough that many fans didn't notice the change immediately, but Jackson himself was reportedly pleased with the outcome. His nose was more slender, and his profile was smoother. However, even this first surgery came with complications. Jackson's skin, which had a tendency toward keloid scarring, reacted to the incisions in ways that would foreshadow future problems. What many people do not realize is that Jackson's subsequent surgeries were not always purely cosmetic. Several of his procedures were reconstructive, necessitated by complications from earlier operations. The second major surgery occurred in 1981, again performed by Dr. Heflin. This time, the procedure was more extensive. Jackson wanted his nose further refined, with a narrower bridge and a more sculpted tip. But there was also a medical necessity. The 1979 surgery had left Jackson with breathing difficulties that required correction. This second rhinoplasty was where Jackson's surgical journey began to diverge from the norm. The additional reduction of nasal structure compromised the support mechanisms of his nose. The cartilage and bone that provide structural integrity to the nose had been diminished, and Jackson's nose was becoming increasingly fragile. Dr. Heflin would later describe the challenges of working on Jackson's nose, noting that the patient's expectations were ambitious while his anatomy was increasingly limited. By 1984, Jackson's nose had undergone 2 significant surgeries. During the filming of a Pepsi commercial that year, Jackson suffered severe burns to his scalp when pyrotechnics malfunctioned. The accident required extensive skin grafts, and in the process of treating his scalp, surgeons noted that his nose was showing signs of tissue damage. The blood supply to the nasal area was becoming compromised, and the skin was thinning dangerously. The third surgery, still performed by Dr. Heflin in the mid-1980s, attempted to address these concerns while simultaneously continuing to refine Jackson's appearance. It was during this procedure that the surgeon utilized cartilage grafts from Jackson's ear to rebuild portions of the nasal structure that had been lost. This technique is not uncommon in revision rhinoplasty, where the patient's own cartilage is used to provide support when the original nasal structure has been compromised. However, Jackson's expectations were not being met. He wanted his nose to become increasingly narrow and refined, with a tip that was sharply defined. He was reportedly influenced by the appearance of classical beauty, particularly the straight noses seen in Renaissance art and the elegant profiles of European royalty. These aesthetic goals, combined with his evolving facial structure as he aged, created a situation where his nose was becoming progressively smaller and more delicate. The period between 1986 and 1988 saw Jackson undergo at least 2 additional procedures on his nose. These surgeries were performed by a different surgeon, Dr. Norman Leaf, though Dr. Heflin remained in Jackson's medical circle. The reason for seeking a second opinion and additional surgical intervention is a matter of speculation, but it is clear that Jackson was increasingly dissatisfied with his appearance. The repeated surgical assaults on his nose were taking their toll, and the structure was becoming dangerously unstable. By the time the Bad album was released in 1987, Jackson's nose had changed significantly from its 1979 appearance. The bridge was extraordinarily narrow, the tip was pointed and defined, and the nostrils had been reduced in size. The transformation was dramatic enough that it became a subject of public discussion, with media outlets comparing photographs from different eras and speculating about the extent of his surgical interventions. Jackson's public statements about the changes were evasive. In a 1988 interview with Oprah Winfrey, he famously attributed his altered appearance to the lingering effects of puberty and diet. He claimed to have only had 2 rhinoplasties, one to correct a breathing problem and one to address the results of the first. The medical reality, however, was far more extensive. The late 1980s and early 1990s represented a period of escalating surgical intervention. Dr. Heflin continued to work on Jackson, but the relationship was becoming strained. The surgeon would later describe Jackson as a demanding patient who was never satisfied and whose requests pushed the boundaries of medical ethics. Jackson wanted his nose to be even more refined, even smaller, even more sculpted. His requests were increasingly aligned with the aesthetic of a Caucasian rhinoplasty, a narrow nose with a straight bridge and a defined tip, completely at odds with his original ethnic features. In 1992, Jackson underwent a procedure that would prove catastrophic. A rhinoplasty performed by a surgeon whose identity has been the subject of debate involved the use of a collagen-based filler in an attempt to achieve the sharpness Jackson desired. The injection of filler into an already compromised nasal structure was a dangerous decision. Within weeks, Jackson's nose began to show signs of tissue necrosis. The blood supply, already fragile from years of surgeries, was completely compromised. The skin on the bridge of his nose began to die, and the structure began to collapse. This was the crisis that would define the remainder of Jackson's life. The 1992 procedure and its aftermath required massive reconstructive surgery. Dr. Heflin was called back to address the damage, and he undertook a complex procedure to reconstruct the bridge of Jackson's nose using cartilage grafts. The surgery was extensive, requiring incisions that ran from Jackson's hairline to the tip of his nose. The skin was lifted entirely, and the underlying structure was rebuilt using cartilage harvested from his rib. The reconstructive surgery was successful in the sense that it saved Jackson's nose from total collapse. But the results were far from ideal. The nose was now visibly irregular, with uneven contours and a bridge that had a slight depression. The skin was thin and fragile, and the risk of future problems was ever present. To maintain the appearance of a smooth, even nose, Jackson would require ongoing interventions. This was when the situation became truly unsustainable. From approximately 1993 onward, Jackson's nose became a medical emergency that required constant management. The tissue was so fragile that even normal activities posed a risk. He reportedly wore bandages and surgical tape to support the structure, and he avoided anything that might compromise the delicate work that had been done. Photographs from this period show Jackson frequently wearing sunglasses and surgical masks, partly to protect his nose from the sun and accidental contact, and partly to conceal the ongoing problems. Dr. Heflin performed additional surgeries in 1993 and 1994, attempting to refine the results of the reconstructive work and address ongoing concerns. These procedures were described as tweaks by those close to Jackson, but the reality was that each surgery carried enormous risk. The cumulative effect of the procedures had left Jackson's nose with minimal structural integrity, and every additional operation brought him closer to disaster. By 1996, Jackson had parted ways with Dr. Heflin and had begun consulting with other surgeons. The reasons for the split are unclear, but it is likely that Heflin had begun to refuse Jackson's more extreme requests. The surgeon had reportedly expressed concerns about the ethics of continuing to operate on a patient who was clearly endangering his own health. Jackson, accustomed to having his demands met, sought doctors who would comply with his wishes. The late 1990s and early 2000s saw Jackson consulting with numerous plastic surgeons, some reputable and some far less so. He traveled to Europe for procedures, seeking doctors who would not be known to the American media. The identity of the surgeon or surgeons who operated on his nose during this period remains somewhat murky, but it is clear that the procedures continued. Jackson's nose in photographs from this time appears increasingly irregular. The tip is sharp and overly refined, the bridge is uneven, and the overall appearance is one of surgical excess. In 2003, Jackson underwent a procedure in Germany that was reportedly intended to correct a breathing problem. The operation, performed by a surgeon whose identity has never been confirmed, resulted in significant bleeding and required emergency intervention. Jackson returned to the United States and consulted with Dr. Arnold Klein, a dermatologist who had treated him for skin conditions. Klein, who had treated Jackson for vitiligo, also provided certain cosmetic injections, though his role in Jackson's nasal saga is complicated and somewhat contested. By 2005, Jackson's nose was in a state of near-constant crisis. The tissue was so fragile that even the application of makeup would cause problems. His dermatologist, Dr. Klein, prescribed various treatments to strengthen the skin and minimize the visible damage. These treatments included steroid injections and the application of topical medications designed to promote healing. But these were temporary fixes at best, addressing the surface while the underlying structure continued to deteriorate. The year 2006 brought another crisis. Jackson, living in Bahrain at the time, experienced a significant collapse of his nasal bridge. The cartilage that had been grafted during earlier reconstructions was deteriorating, and the skin was literally sinking into the void left by the failing structure. Emergency surgery was performed to shore up the bridge, but the results were, by all accounts, unsatisfactory. Jackson's nose now had a visible concavity, and the tip was tilted to one side. This was the situation when Jackson met Dr. Lawrence Coplin in 2007. Coplin, a Beverly Hills dermatologist, was brought in to manage Jackson's ongoing skin problems, including the damage to his nose. The nasal tissue was so compromised that it would not heal properly. Coplin used a variety of treatments to strengthen the skin, including the application of a topical cream called hydroquinone and the use of collagen injections to fill in depressions. These treatments were palliative, designed to manage the damage rather than to cure it. The final surgery on Michael Jackson's nose occurred in 2008. This procedure, performed by a surgeon whose identity has never been definitively confirmed, was intended as a final attempt to correct the damage that had accumulated over decades. The surgery involved the use of a synthetic implant to rebuild the bridge of the nose. The implant, a piece of silicone or perhaps another synthetic material, was inserted beneath the skin to provide structure where natural cartilage had failed. The results were, for a brief time, acceptable. Photographs from early 2009 show Jackson with a nose that appears smoother and more symmetrical than it had in years. However, the synthetic implant created its own problems. The skin over Jackson's nose was so thin and fragile that the implant was clearly visible. The edges of the implant created a visible ridge, and the overall appearance was distinctly unnatural. Jackson continued to wear makeup to camouflage the irregularities, and he used surgical tape at night to support the structure. The implant, like everything else that had been done to his nose, was a temporary solution to a problem that had no permanent fix. The coroner's examination of Michael Jackson's body in 2009 revealed the true extent of the damage. The nose was described in the autopsy report as having a depression on the bridge, which was the result of the synthetic implant. The tip of the nose was irregular, and the nostrils were asymmetric. The report noted that the skin was thin and scarred, with evidence of multiple surgical interventions. The cartilage that had been taken from Jackson's rib and ear was visible, though it had deteriorated significantly. Perhaps most tellingly, the autopsy report noted that the blood supply to the nasal area was severely compromised. The repeated surgeries had destroyed the delicate network of blood vessels that nourished the skin and underlying tissue. This was the reason Jackson's nose was so fragile, so prone to infection, and so resistant to healing. Every surgery had made the next surgery more dangerous, and the cumulative effect was a nose that was literally dying. The psychological aspects of Jackson's relationship with his nose cannot be ignored. He was a perfectionist, driven by a desire for an ideal that was unattainable. The nose he wanted was an impossibility for someone with his original anatomy and skin type. The repeated surgeries were attempts to force his body into a mold that it could not fit. His father's mockery of his appearance during his childhood, the relentless public scrutiny of his face, and the pressure to conform to an increasingly narrow standard of beauty all contributed to his dissatisfaction. The surgical history of Michael Jackson's nose is a cautionary tale about the limits of cosmetic surgery. It demonstrates the principle of diminishing returns, where each additional surgery produces fewer benefits and carries greater risks. It shows the danger of pursuing an unattainable ideal, where the goalposts keep moving and satisfaction remains elusive. It reveals the importance of psychological evaluation before surgical intervention, ensuring that the patient's expectations are realistic and their motivations are healthy. It also illustrates the ethics of surgical practice. The surgeons who operated on Jackson's nose were faced with a dilemma. On one hand, they had a patient who was suffering, in pain, and desperately seeking relief. On the other hand, they were being asked to perform procedures that were dangerous, potentially unethical, and contrary to the principles of good medical practice. Some of Jackson's surgeons continued to operate, motivated by money, fame, or a belief that they could help. Others refused, recognizing that the harm outweighed the benefits. The role of the media in Jackson's nasal saga is also significant. From the mid-1980s onward, Jackson's changing appearance was a subject of intense public fascination. Tabloid newspapers and gossip magazines published endless comparisons of his face, charting each perceived change. This scrutiny exacerbated Jackson's anxiety about his appearance and contributed to his desire for further surgery. He was trapped in a cycle where public criticism drove him to change, and the changes invited further criticism. Jackson's death in 2009 ended the decades-long saga of his nose. The synthetic implant remained in place, and the coroner's report documented the extensive damage. But Jackson's legacy includes more than just the surgeries. He was a singular artistic talent, a performer who revolutionized music and dance. His contributions to popular culture are immense, and they continue to be celebrated around the world. Yet the story of his nose serves as a reminder of the human cost of fame. It shows how the pressures of celebrity, combined with personal insecurities and imperfect medical advice, can lead to a destructive cycle. It is a story about the limits of medicine, the dangers of perfectionism, and the fragility of the human body. The medical literature on Michael Jackson's nose is extensive, but the full truth may never be known. The identities of some of his surgeons remain disputed, and the exact number of procedures he underwent is a matter of ongoing debate. Estimates range from 6 to 14 rhinoplasties, with additional injections and minor procedures that are even harder to document. What is clear is that the story of Michael Jackson's nose is one of tragedy, a talented man trapped in a body he could not accept, and a medical establishment that was sometimes more interested in profit than in the well-being of its patient. In the years since his death, Jackson's face has become an icon of the dangers of cosmetic surgery excess. His appearance is cited as a cautionary example, a warning to those who would pursue an unattainable ideal. But Jackson was more than just a warning. He was a complex human being whose struggles with his appearance were part of a larger story of pain and creativity. His nose, however imperfect and damaged it became, is now part of his legend, a symbol of the extremes to which fame and insecurity can drive a person. The final word on Michael Jackson's nose belongs to the man himself. In a rare moment of candor, he once told a friend, "I don't want to look like myself anymore. I want to look like a dream." That dream, pursued through decades of surgical intervention, ultimately became a nightmare. The nose that Jackson so desperately wanted to perfect became the most visible symbol of his struggles, a damaged monument to the limits of human vanity and the power of surgical intervention to transform, and to destroy. The autopsy report reveals the truth in cold clinical language. There is a depression over the bridge of the nose, and the nasal tip is irregular. The words are stark, medical, and devoid of emotion. But they tell the story of a man who sacrificed his health, his comfort, and eventually his life to the pursuit of a beauty that was never quite attainable. Michael Jackson's nose, in all its complexity, remains one of the most studied and most tragic aspects of a life lived in the spotlight. The medical files are sealed. The surgeons have passed away or remain silent. The fans continue to debate the truth. But the evidence is there, in the photographs, the videotapes, and the autopsy report. Michael Jackson's nose was a work in progress for 30 years, a canvas on which the pressures of fame and the limits of medicine were written in scars and sutures. It remains a testament to the human desire for perfection and the sometimes devastating consequences of that pursuit. In conclusion, the history of Michael Jackson's nose is a comprehensive case study in the medical, psychological, and ethical dimensions of cosmetic surgery. From the first relatively minor rhinoplasty in 1979 to the devastating complications of the 1990s and the synthetic implant of 2008, Jackson's nasal surgeries represent a cascade of interventions that ultimately destroyed the very structure they sought to perfect. His case demonstrates the importance of realistic expectations, the value of medical ethics, and the dangers of the relentless pursuit of an unattainable ideal. The damage was not just physical, it was psychological and social, affecting every aspect of his life. The legacy of Michael Jackson's nose is a cautionary tale that continues to resonate in the world of cosmetic surgery and in the broader culture of celebrity and body image.